personal skills that I verbal and nonverbal communication. The ways to identify it are verbal is spoken word, and nonverbal is facial expressions, body language, and touch.
Basically, verbal is like speaking, and then nonverbal is like using sign language.
Or written. And ways to interpret depends on the condition of the patient.
Like some people might be deaf or like they can't hear, so it really depends.
Is this an example of nonverbal communication?
Mm-hmm.
Okay, so we need to talk about that too, posture and facial expression.
Communication styles are the types of communication are written, and it's usually used with patients with speech impairment. And then, of course, there's nonverbal and verbal. And there are also like body language and stuff. And overcoming barriers to communication. The different barriers are physical disabilities, and they range from deafness or hearing loss to blindness or impaired vision, and aphasia or speech impairment. And with, you want to read this?
With deafness or hearing loss, you can use body language, and for blindness, you can just like talk softly, and for speech impairment, like give them time to communicate and like give them time to ask questions.
There are also cultural diversities, and that ranges from their belief systems, language differences, which that relates to Oklahoma today and healthcare about the population. And then there's eye contact, acceptance of the condition, and touch. And physiological barriers, basically the way to overcome that is respect each person as an individual, and remember that each person has the right to good care and considerate treatment. And this list is basically things to...
You shouldn't do.
Yeah, you shouldn't do. You should always be open-minded. You shouldn't judge or preach or...
All the above.
All the above. Information in order of occurrence. Basically, you use observations like your senses, like sight, smell, touch, hearing, and there's subjective and objective observations, which will explain.
For sight, you can see the color of their skin, the smell, like the odor of their body, the touch, like the temperature of their skin, and the hearing, like respiration. And subjective observations are like the symptoms, but you can't see it. And objective observation is like signs like cuts, bruises, etc.
Okay, communications for appropriate responsive feedback. You need to listen to the patient and, act like you're showing, or actually show interest and be alert and maintain eye contact. And you should avoid interrupting them and pay attention.
Basically, be respectful.
Okay, subjective and objective information. Subjective are symptoms that cannot be seen or felt, and there are statements or complaints made by the patient. And objective are signs that can be seen or measured.
Basically what I just said before.
Medical terminology to communicate information. You use the basic structure of prefixes, suffixes, and word roots to communicate. And you use abbreviations for other colleagues. in the workforce. And oral communication for sender-receiver processes. A sender is someone who creates a message to convey information or an idea to another person. And the receiver is the person who receives a message from the sender. Speaking and active listening skills, you should reflect statements back to the speaker to let the speaker know that the statements are being heard. And restate what you heard so that the speaker knows that you understood. And ask for clarification if you do not understand the part of the message, or if you didn't understand. Written communication, basically it needs to be accurate, concise, complete, neat and legible, and spelling and grammar should be correct. How to organize information summaries. You should chart correctly and efficiently immediately after procedures and observations, and record all observations.
You can use this in the computer too.
Want to play a game?
Yeah.
Okay. In the game that we're going to be playing, we have little strips of paper and it has an object on them, and you have to act out what the object is without speaking or without pointing to like the object or